Good afternoon, Dr. Berger.
Hello.
One of the lifestyle pillars is stress reduction. Can you explain why is it important to meditate?
Absolutely. So, managing stress, chronic stress, is important for a lot of reasons. I like to put this in the context of acute stress versus chronic stress. So, when we were evolving as a species, it was important to have an acute stress response. Like the saber-toothed tiger jumps out at you, you want to be able to run away. So, your blood pressure should go up, your blood sugar should go up to provide energy for your muscles. Your blood flow should be more centralized so you can power the heart and so forth. Your level of awareness should go up. That's all important to escape an acute stressor. But in our society, we tend to have chronic stress, be that due to work, finances, family, all different kinds of issues, of course, and clinical generalized anxiety or other forms of anxiety. But let me talk about why it's really important to manage those kinds of chronic stressors. So, one of the big things is that it can increase your blood sugar. Now, as I mentioned, that's good in the short term to run away from something or what have you, but not long term, because of course that leads to insulin resistance, prediabetes, and diabetes. I mentioned that acute blood pressure increase also helpful for blood flow to run away from something, but of course chronically increased blood pressure, high blood pressure or hypertension is a huge risk factor for heart attack, stroke, and kidney disease. And there are a number of other things that you may not think about with chronic stress. Of course, it impacts sleep because chronic stress is boosting your cortisol, the stress hormone, which is going to make you more energized, amped up, if you will, and can interfere with sleep. And also, while an acute stress could decrease your level of pain, for example, in people who perform remarkable feats of strength when they're under stress to save a loved one, something like that, stories that you hear about people lifting up a car and things like that. And so you don't feel the pain in the moment. But for folks who have chronic pain issues due to arthritis or other causes, the inflammatory state of chronic pain can make all of that worse. And the inflammatory state also can decrease your immune function. Now, your white blood cell count should go up in an acute stress to try to protect you from maybe trauma that's going to cut you open and increase your risk for an infection. But long-term stress is going to decrease your immune system function and make you more susceptible to infectious diseases and cancers. And increased cortisol over time also causes muscle wasting. In the really severe hypercortisolism syndrome called Cushing's, the classic presentation is abdominal obesity and very thin extremities because they lose their muscle mass. So many different reasons that chronic stress is a problem. So what can we do about it? The main things we can do and that everybody should do are lifestyle changes. So daily exercise, getting proper sleep, a meditative or a mindfulness practice can be very helpful. Prioritizing things and maybe not paying so much attention to things that you cannot change or are not really important. All of these things can help us to try to manage our anxiety. Of course, there's a role for talk therapy and sometimes even for medication for anxiety and so forth. But managing our chronic stress, so important for all of those physiologic reasons that I just mentioned, so really important for general health. So if you'd like to learn more about how we might be able to help you manage your stress and thus all of your other kinds of metabolic issues, please give us a call. We're Northeast Medical Practice, the office number 516-604-3418. Or you can reach us through our webpage, northeastmedicalpractice.com. I don't think we mentioned in the beginning, but we are a concierge-style internal medicine, weight management, and aesthetics practice, and we're in Great Neck, New York on Long Island. And of course, everything that I provide in these videos is for educational purposes only. We have not formed a doctor-patient relationship, and if you have questions, concerns about your health, you shouldn't hesitate to reach out to your medical professional. But in the meantime, manage your stress, be in good health, and we'll see you next time.